What a great crowd. Look at this. I'm so glad you're here today. And again, on behalf of the Office of the Surgeon General of the United States, first and foremost, I turn to the WOMAC staff, as well as the community here at Fort Bragg, and tell you that although we come from relatively afar, just down up the road up to Washington, D.C., but the difference between Washington, D.C. could be light years. And it's not necessarily a good thing or a bad thing that oftentimes we're separated, right? That's the land of policy. That's the land of, the Beltway. That's the land of politics. And yet what you do here, whether you're in uniform or in civilian clothes, is actually, folks, that's the real work. You, each and every day, touch people. Right? You provide what is so important, and that we're discussing with your new command here, is the concept of what? Is that it's about care, but it's also about caring. So a big accolade to you and for what you do, for the good of our nation, for the good of our troops, for the good of our family members, for the good of our retirees. So let me give you a standing ovation, guys. So what's the Surgeon General or Acting Surgeon General of the United States? I like to say, if I call myself the Surgeon General, I only get into trouble. So it's Acting Surgeon General. And yet, as Acting Surgeon General, what does that all mean, right? The word acting oftentimes denotes a sense of powerlessness and a sense of being a placeholder. I guarantee you that Rear Admiral Giberson, I think he left, right? He went on some tour because he's heard me speak enough. But anyhow, he's my acting Deputy Surgeon General. And the two of us got into our positions back in July with the resignation of a Surgeon General of the United States, a little early, a few months early, before her 4-year term was supposed to come due. And so we as career officers fell into this place. And yet what we look at, the concept of acting, is actually being empowering. First and foremost, the first 3 letters of acting is ACT, which means do. We are career officers. We have been in the Public Health Service Commission Corps well over, a generation, let's call it. We entered this service when it was really going through a phase where it wasn't thought of as a uniformed service. I was discussing with your command here the fact that when I entered the service, I wanted to be part of the Centers for Disease Control and Prevention. I wanted to be an epidemic intelligence service officer, which was a job I applied for. And along the way, they kind of said, well, you're going to get commissioned in something called the Public Health Service. What I'm proud to announce is with much transformation, which much changes over this generation, we now produce excellent officers, 9 of which are stationed here within WOMAC, and I want those 9 to please stand up. Ladies and gentlemen, these are my troops, right? They're the Army's troops. But they do incredible things each and every day, wearing a different uniform. So when you see them parading around in different uniforms, don't point behind their backs and laugh at them. They're very sensitive. But what they do is they do the Surgeon General's work, the work of the Commission Corps of the United States Public Health Service, which this year is celebrating, believe it or not, as a uniformed service, 125 years of existence. Right, 125 years as being on this planet, and I'm not being derogatory to you guys here in the front or you uniformed personnel out there, but the reality is, almost every country on this planet has what? Has an army, right? Almost every nation has a navy if they have water around them. Many have evolved into having air forces. But the only nation on this whole planet, that has a uniformed service dedicated to the mission of protecting, promoting, and advancing the health and safety of the nation is our beautiful country, the United States of America. So somewhere along this pathway, someone said, if we're going to take public health seriously, if we're going to take prevention seriously, we're going to put these people in uniform. We are going to send them to places to do a mission. We are going to set up a system of history, of protocol, a system of ranking in that scheme. We are going to have a system where people will go out there to serve their nation differently than the armed services do, but with as much passion and as much dedication as our sister services in the armed services. So I'm happy to be here today. I'm happy to be here as the Acting Surgeon General. And over the next few minutes, what I want to get into is going to be a discussion of what we're doing, what the Office of the Surgeon General of the United States is doing. Now, if you look at the job of Surgeon General of the United States, there's two major boxes. Box number one, excuse me, box number one is running a uniformed service. So these 9 officers who stood up, we were discussing earlier, they belong to you, Colonel, but also they kind of belong to me, right? And so they're part of two worlds. And the reality is I have now 6,900 officers stationed in 800 different locations, embedded in 26 different departments and agencies of the U.S. government. So as I mentioned earlier, if you believe conspiracy theories, right, here you have a small unknown service wearing uniforms that make him look like Navy people who have infiltrated the U.S. government at the highest levels. And I'm in control. Ha ha ha. Just kidding. But it's infiltrated in a good way, not for evil purposes. And that's the beauty of this, right? So you have 26 different departments and agencies through the United States government where public health service officers are stationed to do what? To protect, promote, and advance the health and safety of our nation. So the ramifications of this are quite intense. So that's one part of the job, is running this uniform service. We have our policies, we have our uniform authorities, you know, we have to pay them, we have to retire them out, we have to do medical affairs. That's a component of the Office of the Surgeon General. But the one that most people know about, the general public knows about, is this other box. And this other box is this more ethereal concept. And it doesn't get to my head, because I've been in government service, I've been in this uniform long enough, I have no ego left, okay? But this concept of this position, which is very powerful, and again, has existed first as a supervising surgeon back in 1871, and then evolved to be Surgeon General of the United States. And this box is oftentimes termed the nation's doctor. It's termed the bully pulpit. It's the ability to put a person to play the role of getting information out to the nation. If you look at, you know, your chain of command, right? The boss is General Horoho, right, in the medical side of the house, Surgeon General of the Army. And you all know that, you know, there are surgeons general, right? There's Surgeon General of the Navy, the Air Force, the Army. And those three are very important people. But their portfolios, in essence, are within their own uniformed services. Surgeon General of the United States has a portfolio that now touches not only a uniformed service, the U.S. Public Health Service Commission Corps, but in essence has the ability to touch the nation. Which is why sometimes people scratch their heads and say, well, you know, this is kind of weird, right? So General Horoho, we know, came up through the ranks, right? Came in through the nursing category and became a 3-star general to serve in that position. And yet oftentimes Surgeon General of the United States is what? It's actually a political appointment. It's a person who comes out from oftentimes the civilian sector who is put into our uniform. And there are rules associated with this because the law about the Surgeon General of the United States states what? It says that the Surgeon General of the United States shall be chosen from within the ranks of the Commission Corps of the United States Public Health Service. But what we do is, you know, we have a good lawyer. Lawyer said what you do is you take a person in civilian clothes, you commission them as an 06, senior person, and then the quickest promotion ever to a 3-star rank, right? But I'm not poo-pooing that concept because you got to realize that although we sometimes see benefits that a career track person ends up in that position, and in my lifetime there's been one Surgeon General from within the career ranks, the first female Hispanic ever to be a Surgeon General of the United States, Vice Admiral Antonio Novella, was a career officer. But since I've been in, which is since C. Everett Koop, every single other person, including C. Everett Koop, the lion of Surgeons General. Those of you who are old enough to remember, that's the person who stood out. C. Everett Koop came from within the civilian ranks, right? He came in and was thrust into this three-star uniform, but then boldly took those issues in front of our nation back in the 80s. Ladies and gentlemen, fellow officers, fellow uniformed personnel, these were huge issues in the 80s. This was the beginning of HIV/AIDS. How's our nation going to react to that? Well, we know a huge amount of his portfolio was, in fact, educating the nation about that. And to some extent, in the midst of that crisis, this was rather helpful. He was a tall man. He had a great beard. He looked really important. And then you put him in this flashy uniform in the midst of a national crisis, and he starts talking about sex issues. We needed to make sure people listened. This was a public health crisis. And that, perhaps best of all, epitomizes this position, right? Which is somebody needs to be out there talking. One would like to say it's not politically connected. You know, in our world, frankly, everything's politically connected, right? I mean, there's always a little bit of politics thrown in there. We would love to view, and I hope that most of our decision-making is based upon what? Is the job of the Surgeon General in that realm. You take the best scientific information available, and you then communicate it or translate it to the American public. That it starts off with science, evidence-based medicine. And you say, hey, listen, nation, we have a problem going on here. And here's what we need to do about it. So, segue into what are the problems. Well, as part of the Affordable Care Act, we have provisions. You know, I'm not asking you whether you're fans of Affordable Care Act or not. You know, having that discussion, I see your smile here, is in essence, it's like talking about politics or religion, right? We and I can have a big argument. I'm not talking about healthcare financing. I'm not talking about the provision of healthcare. My little piece of the pie is that there are provisions built in the Affordable Care Act that deal with prevention. And in essence, that's the flag we fly, which is ultimately everything that you do. Those of you in clinical care, those of you who are out here in chronic care, acute care, those of you, most of what we're dealing with in this nation are, in fact, what? Preventable diseases. Not everything. You know, we're always going to have illness and injury and sickness and trauma out there. What really frustrates us, and built into the Affordable Care Act, was this emphasis on prevention. It, in fact, took the position of Surgeon General of the United States within the Act and says the Surgeon General shall lead an endeavor in this nation, shall lead a group called the National Prevention Council, which is now 20 different agencies, including the Department of Defense, who sit at the table and say, what are we doing internally for prevention and wellness of our employees, of our workers, of our uniformed personnel? And what are we doing in terms of prevention for this nation with the policies that touch all of America? So National Prevention Council starts up in 2010 under the leadership of the Surgeon General, my previous boss, Dr. Regina Benjamin. That's handed over to me as the acting Surgeon General. A national prevention strategy came out in 2011, and then in 2012, a national prevention implementation plan. And in essence, what's the real vision of this? The real vision of the National Prevention Strategy is to take and refocus of some of our resources and, in essence, get into the 21st century. In the 20th century, we did incredible things. If you think about the fact that in the year 1900, we started out being a certain nation, and that by 1999, 100 years later, at the cusp of a millennium, we were different as a nation. But so was clinical care. We started out in those short 100 years, the concept of antibiotics didn't exist. Right? The concept of major surgeries, oh my God, that didn't exist. And yet the metamorphosis that took place was incredible. We did incredible things for healthcare in the 20th century. We stamped out an infectious disease across the world. Smallpox killed people in 1900, by 1980 no longer existed anywhere on this planet except in laboratories. That was medical progress. And what I'd like to put forward to you right now is, in fact, that the 21st century will still have medical progress, but in essence is now the 21st century has to be an emphasis on the prevention of diseases. So the question to you really is, and I think, Senator Harkin claims ownership of this concept a decade plus ago. And it boils down to the sense is a simple question to you, but I want you to listen very precisely. And the precision I want you to listen to is specifically in my word choice. Do we have a great health care system in this nation? Health care. In essence, if I change the terminology around a little bit, because healthcare, maybe you're starting to think, oh, he's tricking us, right? There's something wrong here. And in fact, I am. Because what I'd like to submit to you, this group of people in the field already, is what we have is really a phenomenal, best in the world, most expensive in the world, but best in the world sick care system. That's what we have. What we have is the ability to take a person with all sorts of different diseases, and we now have pharmaceutical concoctions to give them. We have surgical interventions. We have devices to implant. But what we've not done a very good job on is the front end of prevention. So in this model, simple little prevention exercise. Start off with a little kid, right? Maybe not breastfed initially. We have a breastfeeding initiative coming out of, or came out of the Office of the Surgeon General. That's important. But in essence, maybe it didn't work. Who then becomes a pudgy little kid. Who then becomes an overweight teen. Who then becomes an obese adult. Who then goes down several pathways of diabetes, of hypertension, of cardiovascular disease, of stroke. By the time I get into this thing, I got a handle, man, because you went into diabetes, no problem. I have oral hypoglycemics. Here, take a pill. I have insulin. Here, take a shot. I have monitoring devices that'll actually, I have pumps. Right? What an incredible sick care innovation. I no longer have to stick myself. Everything's being monitored. But the problem, folks, is that had I started something here, perhaps I could have prevented this end point. And that's what National Prevention Strategy is all about. It's the sense of looking at our lives and saying, under a new flag, we've been talking prevention for a long time. You've been at it for a long time. The reality, it's a new flag and a new way of dealing with it, which is looking at the concept of how do we get this instilled into our social norms, the concept of active living. Captain Ellenberg is here. Where's Captain Ellenberg? Deals with the Healthy Base Initiative, right? That's part of the concept of that, right? Is active living, is choosing the right foods, is making sure that on a base environment, we in fact begin this experiment of how do we make our people healthier, so that we go down this pathway of dealing with some of these preventable diseases. Talk about tobacco, right? It's pretty amazing because this year, it's a big year for us, right? This year, January 1964, Surgeon General Luther Terry, Surgeon General of the United States, wore a similar uniform. Put into office, he was a career officer, put into office by JFK, and given the tasking of saying, you know what, we've had a few letters being written in, American Cancer Society, American Lung Association. Our citizens are worried, these organizations are worried about the effect tobacco has. Now, mind you, those of you who are old enough, go back to 1964. The world was different. And in essence, this was an endeavor that came up with a committee. Oh, Government Likes Committee. Committee sat around for a year and a half, looked at 7,000 different sources of information about cigarette smoking. And in 1964, by January 11th, came up with a report. Oh yeah, and there's just another government report. It'll be a report, it'll issue, it won't change the world. No, 50 years ago, it started to change the world. Because in that report, the concluding statement was actually so subtle But I love it because it shows you the beauty of subtle language. The concluding statement of that report said, cigarette smoking is a significant health hazard in the United States. Yes, so it's coming out. First time ever, somebody says, there's a health hazard here, folks. The second part of the statement, however, is almost overwhelming in its subtlety, yet its power. So cigarette smoking is a health hazard of sufficient importance in the United States to warrant appropriate remedial action. Appropriate remedial action? What that's supposed to mean? And yet we have a pathway that goes on from 64 to 2014, 50 years, where we have changed. This is a great experiment. We have changed successfully. And to you naysayers in prevention, if there are any, naysayers say, oh, we're never going to change America. No, we're never going to eat healthy. No, we're never going to get... The reality is we have an experiment that occurred in many of our lifetimes. And that experiment was 64. We're sitting in this room. Half of you, almost half of you, 43% would be smokers. Guess what? You'd probably be smoking here right now. And in fact, 50 years ago, I may be a smoker sitting up here. And the other half who weren't smokers wouldn't say a word because social norms was, this is what people do. So, you know, your eyes are irritated, throat are irritated. If you're not a smoker, or, you know, you may get up and change your seat. But we've created a world right now where I dare say that if I pulled out a pack of cigarettes right now and lit up in front of you, there would be gnashing of teeth, there would be tumultuous feelings, and without a doubt, within about 2 or 3 hours, there would be a former Surgeon General of the acting Surgeon General of the United States. Let's face it, right? So if we're talking about social norms, look at the progress made in tobacco. To now, where even in a state like North Carolina, where we realize we drove in from Raleigh, I see what's going on out there. I know it's a part of the community. But guess what? I can't do this anymore without telling the truth. And the truth is, we once again, in honor of this 50th anniversary, issue a report on January 17th this year, humbled and honored to be the acting Surgeon General that puts the stamp on that report that says we've issued the 50th anniversary report. It's the 32nd such report from the Office of the Surgeon General. Someone has a copy of the executive summary there. Thank you. And we basically say, the mantra now is, you know what? Enough is enough. Because after 50 years, we've made headway. 43% of our population used to smoke. We're down to 18%. That's great. People oftentimes say, well, you've done it already. Are you really going to get... The answer is, no, we're not done. 18% still smokes. Every year, almost 500,000, 480,000 people die prematurely from smoking-related diseases. 480,000. Could you imagine any other major problem we have in this country? That we have 500,000 deaths and we aren't reacting boldly? If I allow the current trends to continue, looking at my demographics, 5.6 million kids who are less than 18 years old who are now alive. These are our children. Line them up. Choose one out of every 13. That kid will die prematurely from smoking-related diseases if I allow the current trend just to continue. We've done it. 1 out of every 13 we're going to accept as a nation, as a proud nation, as a rich nation, as if it's just, you know, let's just accept it. So in this realm of prevention, we have to look at our major players right now. Tobacco remains number one. I got to tell you, 480,000 a year cost to the nation. You want to talk about healthcare finances? $289 billion with a B of direct and indirect costs each and every year to our nation because I have tobacco out there. I realize this is an addiction. I'm also bold enough to call the shots on this one. And with the empowerment that was given us by the Department of Justice, you know, the tobacco companies have been selling us a deadly product. And guess what? They've known about it. They've known about it. They were sued. They were sued on racketeering charges. So as a public health person, I can't remain silent on these things. So enemy number one, tobacco. Enemy number two, if we're looking at initiatives, I got to look at sort of that combination of the obesity picture, the diet picture, and maybe the common thread here is the idea of health and fitness in our society. You know, a few weeks ago, I was giving a talk at the American College of Sports Medicine. Somebody wanted me to say, and actually I said it because I thought about it, was, you know, can you come out and say that, you know, the idea of exercise as medicine, the idea of having a healthy and fit nation, in fact, is part of the, you know, the number one problem we're facing in America. I'm trying to think of, well, you know, maybe I can buy that. Because in essence, healthy and fit people, allow me a little, you know, leeway here, would that healthy and fit person choose a road pathway that includes tobacco products? Probably not, because if you're into health and fitness, if you cherish the fact that your body is part of the natural resources of our nation, then maybe if I really put my emphasis on the sense of a healthy and fit nation, that tobacco problem would start dissipating. Certainly the weight issues of our nation would start going to the wayside. Why? Because we already know it doesn't take running a marathon. It doesn't take the extreme stuff. All I'm asking our nation to do, and we'll be doing this in the next few months with a call to action from the Surgeon General's office, and that's basically a call to action on walking and walkable communities. Guess what? You know, it doesn't take that $150 pair of running shoes. It doesn't take that $60 a month membership in a health club. We've set the parameters so high that we've, in fact, I believe, have discouraged a good subset of our population from even attempting. No, I'm saying start with the basics. You did it when you were a little kid, do it again. Start walking. Right? We took the stairs to this place, right? And it was almost as if the colonel himself said, hey, it's part of the initiative, right? We're walking. It's that sort of mindset of saying, how do we instill that across the nation? Very important that we look at all these prevention activities. And certainly in the world of DOD, you know, fitness is important, right? Fitness to accomplish the mission. We're already there. We got to do work better with family members, with even some of our senior officers, right? But we're there. We know how to do that. We look at our retirees. We have to instill that sense of exercise as medicine into that world as well. In DOD, the tobacco issue is yet another issue, you know? And all I can say is, you know, we're talking about the fact that we PHS, a small service, 6,900 officers, you know, we're proud of who we are and what we do, but oftentimes we follow our big sister services, right? What's the Army doing? What's the Navy doing? What's the Air Force doing? We want to be like them. Here's one example of where you can be like us, because January 1st of this year, the Public Health Service Commission Corps, and people will say, oh, I'm surprised it took you so long, because you know what's weird is we're public health service officers. But we finally signed a regulation on January 1st in honor of the 50th anniversary, and after dealing with all our lawyers and dealing with our policy people and pushback, but bold enough to take the leadership of saying, you know what? No smoking while in uniform, period. You represent something when you're in uniform. You represent our nation. You represent the Commission Corps of the United States Public Health. You represent the Surgeon General of the United States, but even goes further. You represent the President of the United States. You represent the good of our nation. I put that gauntlet down to you guys. Right? Is it difficult? Without a doubt. Is it going to make you unpopular? Probably. But let's talk about the concept of how we get tobacco out of DOD installations. How do we get tobacco out of being associated with a uniform? I need your help on this. So, the prevention box, the nation's doctor box, the bully pulpit box. Other initiatives that are unfolding, we'll put out a call to action in the next few months on skin cancer prevention. On top of the issue of kind of talking about everybody get outdoors and do things, But I, as Surgeon General, and by the way, I'm also trained as a dermatologist, so is this part of my ability to do a bully pulpit on something I think it's important? Yeah, that's how sometimes you get to do it. But so is the Assistant Secretary for Health. So